Good morning, everyone, and welcome to our meeting this morning, the National Association of Public Hospitals and Health Systems. I'm Dr. Kirk Calhoun. I am the chair of the Executive Committee of NAPH, and let me say what a great pleasure it is to be back in my hometown of Chicago. Yeah. It is truly a great city, and you know, it's sometimes easy to forget how great it is. But last night we had a wonderful dinner and drove along the lakefront, and it was just absolutely incredible. And I was able to call my 81-year-old mother, who started her working life at Cook County Hospital. So do we have the Cook County? Yeah, the Cook County delegation here. She originally started at Oak Forest, but when she became pregnant with my brother, she decided that the 3 bus transfers to get out to Oak Forest was a bit too much for her. So she transferred to the kitchen at Cook County Hospital. And I asked her, you know, what did you do in the kitchen? And she said, well, the cart would go out to the wards with all the food on it. And the cook would actually take the plate and scoop different foods out and put it on the plates, and she would take it over and put it at the patient's bedside. And I said, well, how did he handle special diets? And she said he decided what they would eat. and if they were diabetic, he would say, no desserts today for you. If they had high blood pressure, he says, I'm not going to let you have the salt shaker. And so he managed that and went all through the hospital, and she followed him around and put the plates at the bedside. Now, being a very good hospital administrator, I said, well, when you weren't serving food, what other job did you do? Because you had to be doing other things than just that. And she said, I would go back to the kitchen, and I would butter the bread half the day. And then she said, I made the red juice. And I said, red juice? What's red juice? And she said, that was the Kool-Aid, that the patients really loved the Kool-Aid, and she said we would put it in a big vat and push it down the hall and serve it to the patients. But she said one other thing, and that is, she said, you know, working at Cook County and watching the poor patients who did not have resources receive medical care really inspired me to push you to be a doctor. And so I can remember in my youth, she would sort of go, you know, maybe one day you'll be a Dr. Kirk. And it happened. And so I want to thank the folks at Cook County, because I am where I am today because of her service to your institution. So congratulations. Welcome, everyone, to NAPH's 30th Annual Conference. I want to extend a special welcome to half the people in this room who have never attended an NAPH Annual Conference before. But as you turn to your neighbor and say hello, you will all feel like you have known each other for a very long time, as I bet everyone in this room shares my vision about making health care more accessible, with higher quality and a sincere desire to eliminate health care disparities. This feels like a very important meeting to me. We will be doing some celebrating. This is NAPH's 30th anniversary and an important landmark. We will be honoring Larry Gage, our founder, who will be retiring at this meeting. And we are welcoming Bruce Siegel, NAPH CEO, who will take the title of NAPH President and CEO at this meeting. Just opposed to all the celebrating, we will be discussing and strategizing on the very serious challenges now facing safety net providers. A year ago, when we started planning this conference, we selected the themes design, reform, and transform as we focus on the promise of expanded Medicaid coverage. Today we are faced with very severe federal and state budget concerns that now threaten whether and how the reform and transformation occurs. In setting the stage for these discussions that will take place over the next 2 days, I want to reflect on some of the important accomplishments of NAPH since we met last June in Patty Gabo's wonderful city of Denver. At that meeting, you approved a three-year strategic plan for NAPH. The plan is designed to help us navigate the unprecedented healthcare system transformation that is occurring in the United States. As a hospital CEO and NAPH chair, I believe NAPH has accomplished a great deal. This work creates a strong foundation for the future. This past year, NAPH and members have focused on 3 key priorities that shape our strategic plan. First, transformation of safety net hospitals and health systems into integrated delivery systems. Working on this priority, NAPH has conducted advocacy, research, and provided technical assistance. Highlights of this work include helping members move from volume to value. To help navigate this transition, NAPH has advanced NAPH members' interest in the post-healthcare reform environment by commenting on new regulations and guidelines. Some examples include the Medicare Shared Savings Program for accountable care organizations and Medicare hospital value-based purchasing programs. Also, NAPH has had numerous meetings with the White House and administration staff touting the need for a safety net ACO project that is focused on Medicaid and the uninsured population. NAPH has designed, staffed, and is seeking grant support for our new Transformation Center that will help members by providing the resources and the tools to transform how we currently deliver health care and evolve into a more integrated, higher value health systems. Bruce will be sharing more information about the Transformation Center a little later. Second, transformation of safety net funding into equitable, reliable, and sustainable financing sources. A second major priority undertaken by NAPH is working on securing the future of safety net financing. NAPH staff is working with members of an advisory committee and has held conference calls and in-person meetings to develop principles regarding safety net financing. NAPH is laser focused on protecting the Medicaid program from massive cuts. They have been engaged in a multi-pronged advocacy effort to alter the course of the debate by meeting with key negotiators, by joining coalitions, and sponsoring paid advertising around Medicaid and other hospital cuts. NAPH is engaging with our hospital CEOs to set up face-to-face meetings with key senators in targeted states. NAPH is actively working to protect Medicaid from threats to the Affordable Care Act's maintenance of effort on the Medicaid eligibility provision, which prohibits states from dropping currently eligible Medicaid beneficiaries from the rolls. Third, transformation of safety net systems into industry leaders in access and quality of care. The third major priority is work on quality and performance improvement. For example, NAPH has prepared data briefs and is sending them to members of the organizations on our performance and other very selected public reported quality measures. In addition, this past year, NAPH has been very successful in getting a seat at the table for safety net providers by nominating individuals from member hospitals to sit on several national quality steering committees. To help realize these priorities and others, NAPH has 4 strategic initiatives: leadership development, member support, research, and communication. Let me go through each of these. First, leadership development. To that end, 30 leaders completed the 2010 Fellows Program earlier this year, and 24 leaders are participating in the 2011 Fellows Program that began earlier this week. Do we have any of the fellows in the audience? Okay, hey, stand up. This is our future. Please stand up. I'd like the fellows to stand up. Very good. This year's program is focused on how to boost hospital physician alignment. Graduates of our fellowship program, including this one, have assumed important leadership roles in our health systems within NAPH. Member support. NAPH is working every day to increase member engagement. We do this by providing a wide range of information to support advocacy activities and health system transformation. We participate in biweekly government relations calls, our weekly and monthly newsletter, with the latest advocacy updates and information on member innovations, and twice monthly web calls focused on a variety of key issues. These calls have involved more than 1,000 members during the past year, 2 lobby days, and several advocacy groups. In addition, NAPH distributes scholarships to NAPH members to participate in the IHI training program. If you want more information about any of these activities or how to increase your engagement in NAPH activities, then please talk with any NAPH staff member present here. Third, research. NAPH and our affiliated institute, NPHHI, are very busy conducting surveys on utilization trends at member hospitals and surveying how hospitals reduce readmissions. Results of this work are used for advocacy and to assist member improvement. And then finally, fourth, communication. I hope all of you and your staffs utilize the NAPH website. It is a great resource. I understand that there were more than 58,000 unique visitors this past year, a number that almost doubled from the previous year. At this conference, NAPH will be introducing the NAPH member community, an electronic tool to help us stay connected and to learn from each other. These are just several highlights of how the work of NAPH is helping to make NAPH the leading voice for safety net hospitals. NAPH membership will help our precious healthcare institutions meet the needs of today and the challenges of the future. I look forward to the discussion over the next 2 days as we review and discuss many of these initiatives. Thank you very much for allowing me to be your chair. Thank you for your attendance, and thank you for your active participation in this year's National Association of Public Hospitals and Health Systems annual meeting, and for allowing us to get started today on such a really great start. At this point, I would like to hand the podium over, but if I can have my slides come up.